to the Nursing Community Assessment Service, or NCAS for short. We hope that this orientation video gives you a better understanding of what to expect from the simulation lab assessment and the oral assessment that you'll be taking.
In this video, we will introduce you to the assessment process, take you through the lab, and discuss the procedures and rules you will need to follow during the assessment. Another video will show you the equipment and supplies you're likely to encounter.
You can get more information on our website. We encourage you to familiarize yourself with the many resources you will find there.
First, a quick reminder. We call the simulation lab assessment the SLA and the oral assessment the OA. They are both designed to give you plenty of opportunity to show us the knowledge, skills, and judgment you have gained from your nursing education and experience.
If you've registered for the SLA, then you probably already know that automatically registers you for the oral assessment. That's because the two assessments take place at the same time. You can learn more about how to schedule your assessment by visiting our website.
The two assessments, the SLA and the OA, take anywhere from 3 to 6 hours, depending on which profession you are being assessed for. To complete your SLA OA, you will need to attend an NCAS assessment center in person. NCAS operates 2 assessment centers at Langara College in Vancouver, British Columbia, and at Dalhousie University in Halifax, Nova Scotia. Where you complete your SLA OA depends on the regulatory body that referred you. Try to arrive with plenty of time to spare, at least 30 to 60 minutes before your assessment, so you have time to find the simulation lab location. If you are completing your NCAS SLA OA in British Columbia, you will have to attend Langara College in Vancouver in order to do the assessment. Getting to Langara is easy. You can get to the college by bus, SkyTrain, or car. The lab is located on the 3rd floor of the Science and Technology Building, the T Building. It's the modern-looking building on campus. Signs will help guide you to the lab. Someone will be there to greet you when you arrive. If you are completing your NCAS SLA OA in Nova Scotia, you will have to attend Dalhousie University in Halifax in order to do the assessment. Getting to Dalhousie is easy. You can get to Dalhousie by bus or by car. The lab is located at the Centre for Collaborative Clinical Learning and Research, or C3LR, located on the 3rd floor of the Collaborative Health Education Building. Please enter the building from the Summer Street entrance. Signs will help guide you to the lab. Someone will be there to greet you when you arrive. At both sites, you will have to pay for parking on campus. You will not be able to leave the assessment to pay for your parking or to move your car.
Remember, it's very important that you have applied in advance if you have medical or other needs that may require some sort of special accommodations during the assessment. Visit our website to learn about the forms you need to fill in. You can't be granted a testing accommodation on site if you haven't been given approval by NCAS in advance. Once you arrive, you'll have to show us your ID. Your ID must be valid. It can't be expired. It must be government issued, and it must have your photo and signature. In return, we'll give you an NCAS badge with your NCAS number on it.
When NCAS received your referral from your regulatory body or registry, you would have signed a confidentiality agreement with us. In this, you agreed not to share with anyone in writing, orally, or through social media any of the assessment materials, questions, or cases. There are serious penalties if you do happen to disclose anything about the assessment. Remember that this assessment is confidential. You have also consented to the audio-video recording of your SLA OA assessment, which NCAS will use for purposes of scoring validation, quality assurance, and training.
You'll need to be dressed appropriately for your assessment. If you are an HCA, LPN, or RN, you should wear scrubs. If you are an RPN, you may either wear scrubs or business casual clothing. You can either arrive wearing your clothes for the assessment, or take a moment to change in the bathroom if you arrive early enough. If you're an LPN, RN, or RPN, you'll need your stethoscope. Don't forget.
You'll be given a locker to put all your stuff in. That includes your watch, your phone, any bags, your purse, wallet, and any other belongings. We'll give you access to your locker again when you leave. You might get hungry or thirsty while at the assessment center, so we recommend you bring a see-through water bottle and a snack. You can bring these with you. We will show you where to leave them so you can access them in between stations. You may need to bring a lock for the day for your locker. Once all of that is done, you'll be ready for the assessment day orientation.
You'll be led to the orientation room, where you'll join a handful of other assessment takers and be given a 45-minute to an hour-long orientation. You'll be shown parts of this video. You'll also be reminded of the ground rules for the day. Then, you will be given a tour of an assessment room or station, and then have some time to try out some of the equipment and supplies. You'll also have the opportunity to ask questions about the assessment procedures.
Then it will be time to get started. You'll be led to the hallway outside your first assessment room. In the hallway, you're not allowed to speak with any of the other people taking the assessment. You also can't ask staff any questions about the assessment content. When the assessment is all set up, you'll be asked to enter the room.
The simulation lab assessment and the oral assessment unfold in 4 different assessment rooms or stations. Each room is set up to reflect a specific kind of practice setting, allowing you to demonstrate a full breadth of nursing practice. The rooms may look like an acute care or chronic care facility, or represent a community care setting, like a community clinic, or someone's apartment or home. You'll notice the home has a simulated washroom and a kitchen. Even though it's a simulation, we expect you to treat this assessment as if it were a real-life setting. Do everything that you would do in a real clinical setting. The time you're given to complete the scenario in each of the 4 rooms is limited. Here's how much time you have.
When you first enter the room, you'll be greeted by an assessor. The assessor may either have a small laptop or tablet, or a clipboard with paper on it. That's what they use to score your performance.
You'll also notice cameras in the room that will record your performance. That's because we videotape every assessment for our records. The first thing the assessor will have you do is face one of the cameras, state your name and NCAS number, and hold your badge up to the camera.
Your performance will be viewed by a camera technician who will be remotely operating one of several cameras in the room.
Notice the date posted in the room. It isn't going to correspond to the date of your assessment. We've preset the date, and it will be the same in all scenario rooms. You'll also see a clock on the wall. It's set to reflect the time of day that the scenario takes place. It's important that you use this clock for anything scenario related, like your documentation or medication administration. The assessor may also say that a certain period of time has passed, overriding what the clock says.
The next thing you'll see in each of the rooms is the patient chart or binder. You'll begin by taking a few minutes to review it. You'll also see a pen and paper. Feel free to take notes, but you'll need to leave any notes you take in the room before you leave. These notes are for your use only. They are not assessed. The assessor will let you know when your reading time is up. That's when you begin the scenario itself. You can come back to the binder during the assessment. The time you will be allowed for your scenario depends on which assessment you are signed up for. Next, you will meet your patient. Some of the stations will have an actor who has been trained to portray a scenario for you. Actors have been given a script to help describe their condition. We want you to interact or engage with that actor as if they were a real patient.
Hello, Mrs. Smith. How are you?
I'm fine, thank you.
The actors will only pretend to eat or drink what you give them, so please don't force any food or drink. the assessor or actor will acknowledge your actions. Since they are actors, you will not need to expose their genitals or sensitive areas.
In other stations, you will find mannequins. In these stations, the actor is actually behind the one-way glass and will speak to you through the mannequin. We know it's not perfectly natural, but you must talk and interact with the mannequins as if they are real patients. They will talk back.
Hello, Miss Smith. How are you doing today?
I'm doing well, thank you.
Like the actors, the mannequins can't actually eat or drink, so you'll have to pretend you're feeding them. Please don't actually drop food or liquids into their mouths. We don't want to break them. Since they are mannequins, you can remove any clothing you need for you to offer appropriate nursing care.
There are a couple of things to keep in mind as you're in the simulation room. It's really important that you speak your thoughts out loud so we have a good idea of what you're trying to do and why. You should explain your actions directly to the patient.
I'm going to wash your arms next.
Alternatively, you might say what you're doing directly to the assessor.
I'm now going to wash the patient's arms.
It isn't enough for you to just say what you would do. You'll also need to show us how you would do it. Assemble the equipment for the procedure and actually perform it on the actor or the mannequin.
Let's focus for a moment on what the role of the assessor is in the room. Their main role is to just watch and score your performance. They can't tell you how well you're doing or tell you if you're doing something wrong. But there are some times when they might talk to you. In some stations, for example, the assessor may tell you what the vitals are and give you some information.
The blood pressure is 130/90.
As you describe what you're doing out loud, the assessor may give you assessment findings.
The pulse is 100 beats per minute.
During the assessment, you may hear the assessor say something like this.
Please move on.
If you hear those words, you can stop trying to demonstrate the skill you are currently demonstrating and move on to the next activity. It means that the assessor no longer needs to see the skills you are currently demonstrating. You may also hear the assessor say,
That's an unsafe procedure. Do not proceed.
The assessor will say this if you're about to do something that could hurt yourself or the patient, or if you're about to damage the equipment. If the assessor says this, stop what you're doing and try it again using a safer technique.
We want to give you the best chance to demonstrate your skills while taking this assessment. In rare cases, the assessor may say something to make sure we can evaluate your nursing fairly and accurately. For example, the assessor may say,
Please review the chart to make sure you're meeting all the expectations of the scenario.
In that instance, you should stop what you're doing, return to the chart, and decide what to do next. Sometimes you might start to describe your skill and forget that you need to show us your skills. The assessor will remind you that you need to show us what you're doing by saying,
Please show me the skills or procedure using the equipments provided.
Although it happens very rarely, the assessor might need to hear you explain the skill instead of doing it. They will say,
Please stop what you're doing and explain it to me instead.
As part of your scenario, you may need to call for some help from another professional. You can do this using the phone in the room.
Hi there, Dr. Kowalczyk. My name's Nurse Adam, calling from Ward A4 about your patient.
When you pick up the phone, there won't be a person on the other end, so don't wait for someone to answer. Just say what you would like to say and hang up, just like you would leave a voicemail message for someone. The assessor will provide you any information if necessary.
The scenario will end when time runs out. If you're ever unsure of how much time you have left, you may ask the assessor. The assessor will tell you how much time, approximately, you have left. If you have completed your nursing practice before the time is up, review the chart to make sure you haven't missed anything and simply wait patiently. If you are still conducting your work, you will need to stop what you are doing. At that point, the assessor will ask you to take a seat near them and your oral assessment will start. The assessor may take a minute or two to finish scoring your simulation. Take the moment to take a deep breath. Then the oral assessment will begin.
In the oral assessment, you'll be asked 3 questions in each of the 4 assessment sections, and will have about 3 minutes to answer each of the questions. The assessor will hand you the questions in writing, so you can read the questions at any point during those 3 minutes. These are aimed at exploring your critical reasoning skills and judgment. They may be directly or indirectly related to the scenario you've just witnessed. Don't hesitate to repeat yourself if you think the answer you've given in a previous question is applicable to a new question. The assessor needs to hear your full explanation within the time given for each of the questions.
The oral assessment questions are timed. You can't move to the next question faster, and you can't go back to a previous question. This means you might hear some silence when you are done answering the question as you wait for the timer to run out. You also don't have to start speaking right away. If you like, you may jot down some of your thoughts on paper first. Just remember that there is a time limit. The assessor will let you know when your time is up on each question. As they did during the SLA, the assessor will be scoring your responses as you go along. When you've finished your oral assessment, you'll be asked to leave the room. You'll be met outside by assessment staff and asked to take a seat outside the next assessment room. Just remember, there's no talking allowed outside of the room. Please don't talk to an actor, a friend, another person taking the assessment, or an assessor when you're outside of the assessment room. If you need help with something, you may talk to any assessment staff. If you need to use the washroom, please let the assessment staff know. Your snack and water bottle, if you've brought them, will be available to you at your chair. When you've completed all of your scenarios, you'll be done. Simply hand in your ID badge, grab your water bottle, and any items you might have left in your locker, and sign out. Once you have completed all the components of the NCAS assessment, the SLA, the OA, and the computer-based assessment, NCAS will blend your results together into one performance report and send that report to you and to the regulator that referred you. For information on our timelines, please visit our website. A video showing some of the equipment you will be expected to use during your assessment can also be found on the website.